Thanks everybody for coming here today. We're going to get started. We have a lot to cover. So my name is Sarita Wilkins. I'm the communications strategist for the National Resource Center for Refugees, Immigrants, and Migrants, or NRC-RIM, and I'm going to be moderating this webinar today. So first, I just want to go through a couple of housekeeping items. This webinar is being recorded, and all participants will receive an email after this with the recording, the slides, and links for all the resources that we're going to cover. So I just want to first give you a little bit of background of NRC-RIM. NRC-RIM is funded by the CDC and housed at the University of Minnesota. And we exist to support health departments and community organizations working with refugee, immigrant, and migrant communities that have been disproportionately affected by health inequities. We do that by strengthening partnerships between health departments and communities, and by supporting organizations working directly on the ground. So I just want to quickly talk about RIM communities generally. So today we're going to talk about some of this health disparities. We're talking about language barriers and how to overcome them. But before we do that, I want to remind folks that refugees, immigrants, and migrants also have a lot of strengths and make excellent partners. We believe strongly that public health solutions should not be done to communities. They must be done with communities. And the translation and cultural validation process we're going to talk about today embraces this concept of partnership. Refugees, immigrants, and migrants are our neighbors and friends. They're business owners and entrepreneurs, they're parents, they're grandparents, they're artists and musicians. They care for the sick and the elderly. They bring food to our stores. They educate children, and they pursue their own education. Without refugees, immigrants, and migrants, our communities would not thrive as they are today. So there's more than 40 million people living in the United States who were born in another country. And this is a group that's super diverse. They represent many different cultures, languages, regions of the world, as well as motivations for coming to the United States. Communities represent a wide range of socioeconomic statuses, educational attainment, English proficiency, occupations, and they also face different barriers to public health and healthcare services. And we know that despite their challenges, refugees, immigrants, and migrants are an integral part of our nation's social, cultural, and economic vitality. They've proven that they're strong, they're resilient, and they are dedicated to the success of the communities where they live. And with the right tools and in partnership, we can help eliminate the health disparities that they face. Now, NRC-RIM was established specifically to work on COVID-19. Now we've since expanded to other things, but we know that COVID-19 disproportionately affected some populations, and that includes certain refugee, immigrant, and migrant communities. And this disproportionality exists not because of any biological or genetic factor, but because of longstanding systemic health and social inequities. And ensuring high quality health education and communications program that is culturally and linguistically relevant is necessary to overcome these challenges and improve health outcomes in these communities. So there's multiple factors that drive health inequities, including, for example, work environments that make social distancing challenging, tenuous social and economic positions that make prevention and mitigation activities like quarantine and isolation more difficult. Immigration status for some folks, and also other barriers to healthcare access. So when people think about barriers, language barriers specifically, they often think of that barriers to access. Can they read and understand the advertisement for your vaccine clinic? Can they read the bus schedules to get there? Do they understand the instructions given to them by your staff? And these are obviously very important to address, but one thing that people might not realize is that language barriers can be a barrier to vaccine confidence as well. So I've heard from community members who said that preventative medicine isn't practiced in their home countries. So they might not realize that the vaccine is not the same as a cure. So they might think, oh, well, I don't need the vaccine because I'm not sick. And we know that some people just need more information. Educational materials that are in a language and format that they understand will go a long way in supporting vaccine confidence. And immigrant and migrant communities deserve up-to-date and accurate information about vaccines, about any public health measure that is culturally and linguistically appropriate. So with that, I will introduce our panelists today. Lena Zara is a project and operations senior coordinator for the International Rescue Committee and a Syrian American social impact specialist. Currently, she coordinates project developments for IRC's project called the Center for Adjustment, Resilience, and Recovery, or CARE. CARE's work focuses on providing quality mental health and psychosocial support services for children and families who've experienced forced displacement by acting as a bridge between refugee, immigrant, and mental health providers. With over 7 years of strategic humanitarian community outreach, program management, and advocacy experience, she's worked with small to large scale nonprofits, NGOs, and government agencies like the World Food Program, International Rescue Committee, Karam Foundation, and the US Senate. She has a master's in international development and humanitarian emergencies from the London School of Economics, with a particular interest in amplifying community voices and shifting the narrative alongside globally displaced persons. Jean Dadou Mukunzi has been a public health professional for more than 17 years. He's the founder and executive director of Ebenezer Healthcare Access, a 501c3 nonprofit that helps immigrants navigate healthcare and other community resources by overcoming language and cultural barriers. Prior to his current position, Jean was a population health project manager at Ohio State University Medical Center. Jean was born in Rwanda and has been in Dayton, Ohio since 2008. He holds a bachelor's degree in clinical psychology from the National University of Rwanda and a master's degree in public health management from Wright State University. Jean holds a project management professional certificate and is fluent in 5 languages. He's been coordinating a team of multilingual medical professionals to review and validate messages to be used by immigrant populations in the Miami Valley region. Welcome, Jean and Lena. This is just a quick overview of what we're going to go over today between these two panelists. And I know that folks will have a lot of questions, but don't worry because we will have time for a Q&A at the end. And with that, I will turn it over to Lena.
Thank you so much, Sarita. And thank you for that wonderful foundation. And I'm so grateful to be in this space with NRC Room once again, and also with you, Jean. It's an absolute pleasure. So going off of what Sarita has mentioned in terms of access and language accessibility for RIM community members, it's a great segue into understanding the need to connect RIM communities to safe, high quality information and resources that are responsive to their needs. How? By reviewing and sharing materials and with respective information in ways that are going to resonate with community members, in ways that it's going to be able for them, for individuals to understand based on education, perhaps country of origin, and certain backgrounds as well. So with that being said, the process that we at the IRC and others, especially my colleague Jean, have adapted is a process that we call cultural validation and translation review. Essentially, it's where bilingual, bicultural community members or multilingual, multicultural community members review materials and provide feedback essentially before and after translations to ensure we are having accurate and appropriate translations, cultural acceptability and appropriateness, and linguistic nuances. Now, we do have a slight differentiation between cultural validation and translation review here at the IRC. So cultural validation you can think of as reviewing and providing feedback on content currently in English to make sure the content and the material is properly cured for the audience, maybe finding any potential red flags before it goes into translation. With translation review, we're reviewing and providing feedback on already translated materials to assess whether the translation is accurate, understandable, and likewise culturally appropriate. Now, language is individualistic, so the translators may have different opinions, maybe the best word or phrase or necessity of certain words and placement. But that being said, through this process that we're going to talk through today, we want to clearly kind of help the reviewers kind of be able to state their and understand their role and scope and focus. And ultimately, through this process, we recognize and understand that community members truly bring invaluable perspectives to best shape and frame the messaging resources themselves in order to reach communities in the best way possible. We're ensuring that cultural and linguistic appropriateness, but at the same time, embracing communities' preferences and backgrounds. In a way, you can think of this as language justice and access. So this toolkit here, if it hasn't already been shared in the chat just yet, goes into how we capture that feedback. What How do you go about it? Kind of the what, where, when, and why. I hope this is a useful tool to anyone who considers adopting a similar practice, but just to show again how we go about highlighting and understanding those cultural and linguistic differences among communities. What is going to be that accurate representation? What is the intended message, and how we're sharing that message out, and what available and possible of diversity of formats that will also get into just understanding what is needed to really capture potentially important and significant edits. Next slide, please. All right, so you might be thinking kind of what does this process essentially look like, and what's the importance of this? So getting that critical livelihood and public health messaging that Sarita had mentioned in her overview, and getting that directly to communities, decreasing any knowledge and service gaps really starts by incorporating those appropriate responsive messaging as early on as you can. And so the different ways that we do that is kind of what you see on the slide here is what are the areas that we are addressing, kind of pre and post translation to account for the very rich and different backgrounds of our communities. So things that are accounted for are ensuring there's no cultural misalignment or ways that things could be potentially misunderstood or even stigmatizing or offensive, and even addressing aspects such as historical discrimination appropriately. We are suggesting words, phrases, images, captions that are going to better capture those cultural linguistic nuances and semantics, and then meanings that are essentially culturally bounded based on values, beliefs, norms, or understandings for communities. We want these to be ultimately culturally resonant. So, bridging also the context of where families are here in the US, but also from countries of origin, addressing any culturation gaps and cultural shifts, especially within families and different family dynamics that may have changed in the migratory journey. Essentially ensuring also that messaging is flexible and is going to address the subject matter in a way that's going to be best understood by the community, or at least at the very least meets the needs of multiple communities and language groups. So this feedback accounts for the varying abilities of the attended audience, those key cultural background and perspectives, and then different, perhaps even different dialects from certain communities, from potentially there are differences even within the country alone. And even something that always comes to mind is Western idioms, for example, that don't always translate in the same way as that we might intend. So this feedback really ensures what I like to call kind of three key areas: relevance, accuracy, and acceptance. So, relevance in the sense that being informed by the community is going to have a greater impact. Accuracy in the fact that something that is reviewed is more likely going to have a more accurate and resonating end product. And then lastly, acceptance, kind of that buy into the community. Accurate and relevant materials help increase that trust between the recipient and resource provider. So when you're thinking about almost like that why factor, I think of relevance, accuracy, and acceptance. And we track this through the cultural validation and translation review process that I will get more into momentarily. The next slide, please. We have a very short but very meaningful and impactful video that we'll share a brief clip of from one of our wonderful cultural validators, Rezo, originally from Afghanistan, to understand really kind of what it means to her specifically, because I think it's important to hear not just from me, but from what content and cultural validators themselves view as the importance of this process. And if we can play this quick clip, that would be amazing. All right, might have some sound difficulties, but that's okay. Um, but otherwise, what's really amazing about this clip, and I know we're going to drop the link to the YouTube clip in the chat. Thank you so much, Allison. And I highly recommend you listen to this. There's also captions for you to read along as well. If for you or any colleagues who are hard of hearing, just to get a sense again from the cultural validator themselves, the importance of their role and why they advocate for this type of practice in various projects. And then Areza also starts to share certain examples that are specific to her community for Daria and Pasha speaking individuals, and then also her own tips and recommendations about how to go about cultural validation. So I highly recommend that you please listen to this on your own time. And so sorry we aren't able to listen to this today. All right, we can go on to the next slide. All right. So before going into the specific aspects of the cultural validation process and how it looks like at, let's say, our organization, I definitely want to go back to a great point that also Sarita mentioned is that working alongside communities and that community-centered feedback. So it's important to discuss not only the importance of what is being said, but also how it's delivered. Now, seeing and hearing information coming from a trusted community member truly does matter and has an impact. We work in tandem with the communities to create messaging and also offer things such as scripts, checklists, training, and support for communities to provide feedback and input on materials and interventions. We want this to also be a very mutually beneficial process as well to support our community members in their aspirations and their goals in this process. And also on that same token, support so community members can create hyper local messaging themselves. To be able to, like, for example, what you see on the slide here is on the left is a checklist that you'll find in the toolkit on how to collect feedback, in which we go over with our reviewers and get also their feedback on what is best to collect and how to represent that. But also, if you see on the right, a video on you'll find on the NRC RIM page, we offered scripts and support for our wonderful religious and community members to create that hyper local messaging themselves. As again, to stress that importance that seeing and hearing from that community member does go a long way. At the same time, we also may need to respect that many things, maybe things are discreet or personal and private. Perhaps a community member actually may not want someone from the community to be a part of that information exchange, especially if that information is sensitive, for fear of cultural shame and stigma. For example, working with some of our Ukrainian community members in the past, they prefer private messaging outlets or taking information in a private space and manner. So those are things that we also want to say to be mindful of and not to include any kind of previous, potentially maybe unintentional, but biases of how we share information and what we kind of contribute to our community members as possible options. Again, providing scripts, sharing perhaps for members to share why they got the COVID vaccine or why they want to keep their children safe and healthy. There are definitely different mediums that we'll go over to once again work alongside our community members. Next slide, please. All right. So this is a very brief overview that it's gone a little bit more extensively in the toolkit. And also I know my wonderful colleague Jean will also share the wonderful process that his organization provides. But just to kind of quickly provide some context about how we go about this process here at the IRC kind of involves a few, I would say maybe even tips I would recommend if implementing a similar process in your organization. You might think, well, what type of kind of review do I need? Is this something I truly need at my organization? We do say when providing anything that is motivating, influencing, or sharing information that is sensitive in nature, you may choose to include this cultural validation process in your messaging practice. It could be done individually or in focus groups, depending on the time, level of sensitivity, maybe how long lasting the material is expected to be. Let's say, for example, you have a flyer for an upcoming community health event. You may just need one, maybe max two individuals. If you're developing a curriculum that may need several people with ongoing support, that would be a different approach to take. Perhaps you're creating a campaign to encourage vaccination that might require one or more community focus groups. So being clear on your purpose will definitely determine the type of validation and review that you need early on. Now, when thinking about the individuals and who should I work with, one thing I do want to stress is working, and I'm so grateful to continue working with cultural validators, is knowing that they come more than just this language expertise and competency. You are essentially working with individuals with rich cultural, family, and historical contexts that are help shaping that messaging or helping shape that final message delivery. Now, there are no clear accepted industry standards or certifications on who can provide this, but we have some suggestions based on what has worked well in the past. For example, let's say for cultural validation, if the materials, again, once again, sensitive, long lasting, or there's a high chance of it being repeated, you might want to use several reviewers to ensure that different community members are able to voice their opinion and reach a consensus. Ideally, these are bilingual community members and share characteristics with the intended audience as well. They understand the context between the client's origin and the resettlement community. And we also do recommend basic digital literacy to be able to have that comfort level of providing that feedback in the English context. Now, with translation reviewers, we do recommend these individuals be trained translators who also share key characteristics of the intended audience, also perhaps live in the same country as the intended audience. And with this kind of review, we definitely encourage strong digital literacy, only in the sense to, again, once again, have a comfort level of being able to provide feedback in English, but also the intended language on the documents themselves. And one thing I do want to stress in this area, if there's anything I stress today, is your agency, you might already be thinking, oh, yeah, I have trained translators, interpreters, or people on my staff that could be really great in this role. But that being said, please make sure that these staff have adequate time to dedicate to these tasks and they're fairly compensated for their expertise. If you're doing any key informant interviews or focus groups, participant incentives should be offered to recognize time and expertise. Now, the last few steps I'll just briefly go over that are also outlined in the toolkit, but essentially that checklist. So providing a checklist, being very clear on the purpose of the document, who your audience is, again, those key sensitivities and characteristics are really important to vocalize to your viewers so they know exactly what they're looking for. And again, that scope and the intended purpose of the document. And then you'll also want to be organized in the fact that you might have different versions going back and forth with different feedback. You might be sending things back to the translator or author to incorporate those changes. So it's really important to stay organized and to synthesize that feedback and the evolution of the multiple versions of the document. So I always recommend just putting together a simple spreadsheet. You could do Airtable if you'd like, and clearly labeled, Box or Google Drive folders to again keep track of those different versions. Next slide, please. All right. And you might be thinking, okay, so what are the different types of materials you might be working on? Um, I'll briefly go into kind of the different mediums, and really the important thing I want to stress here is having effective mediums and distribution channels for access to diverse groups of people. So that could be graphics, social media posts, scripts, flyers, handouts with audio and video, incorporating captions or subtitles, using terminology that is more kind of everyday language or accessible for a wider group of individuals. You want to keep that in mind, even in the early production phases, but also in the communication channels. Ask your reviewers, should we be using WhatsApp, Facebook, flyers, reaching to local religious or cultural community centers? It doesn't end at the review. Even the dissemination channel is where you could really work very closely with those cultural validators to effectively reach community members. Next slide, please. And then to wrap up my portion of the discussion, I just wanted to share a few very quick examples of kind of this review and action. I know there's a lot to take in, but to think about just the importance and how much I certainly advocate for this process. One example here is we had a video script to and basically show and showcase to individuals how to protect yourself and your family members from the rise of COVID variants. Now, this was translated into Ukrainian, and we had two reviewers indicate that there was a portion that a word that said will when it was when it was should have been could. Now, just this one word felt too assertive. It was a bit subjective, but it felt like it could be interpreted in a negative way by our clients, especially resurfacing potential historical trauma related to enforced government practices. So even just as simple as one word can really impact and influence how that message is received. Next slide, please. Okay, and the last thing I want to mention are two very quick examples. So showcasing a different medium, here we have a graphic. And this was from the NRC RIM Don't Miss Out graphic, campaign. This was intended for our Dari and Pashto speaking individuals from Afghanistan. Now, we received immediate feedback on the graphic on the left that the images don't match the Afghanistan culture. The culture is mostly traditional, strong religious beliefs, and having the women also represented in this type of manner and clothes would actually be seen against this culture. So even not just the text itself, but the images of what potentially community members might receive will have a very large impact on how that message is received. And one very last quick story before I turn it over to my colleague, John, is that we actually had a story from our wonderful Atlanta office who's continuously doing vaccination events. And they actually had a poster about wearing a mask early on in the pandemic. And it was incorrectly translated in Arabic. The way it was implied, El Clinan was wearing a full mask, almost like a Halloween mask, when it should have been Kemamet, our traditional N95 mask. So it can be as simple as alienation or a total maybe disconnect with our communities. But for me and our respective organization and our agencies, culture validation has made a huge impact and continues to do so in so many ways. With that being said, I would be happy to turn it over to my colleague Sean to hear about the wonderful work his organization is doing.
Thank you very much, Lina, for the great information that you just shared. Again, my name is Jean Dodier Mukunzi. As they said, I'm the Executive Director of Ebenezer Healthcare Access. And I'm glad to meet all of you on Zoom. So in the next few slides, I'm going to share with you how here at Ebenezer Healthcare Access, we translate materials by making sure the content of our messages is medically accurate. Also by making sure the culture of the clients who will use the material is put in consideration. So next slide, please. So in the next slides, I will give you an overview of Ebenezer Healthcare Access. I will share with you the translation flow charts for brochures, slides, and posters. I will share with you the flow charts for videos production. And also, I will share with you how we were able to form a team to validate the content of the messages that we produce for our clients. Next slides. So Ebenezer Healthcare Access is a nonprofit. We are based here in Dayton, Ohio, and we partner. We work in partnership with the Montgomery County Public Health Department, and we help immigrants to navigate healthcare system and also to navigate other community resources. The services we provide includes health education, medical scheduling, cultural competency training, scheduling medical transportation, applying for employment, applying for health insurance, and make sure all the social determinants of health are addressed within the refugee immigrants population located here in Montgomery County. Next slide, please. So our mission is to promote healthcare access by overcoming language and cultural barriers. And our vision is to build a community free of health disparities by providing healthcare access to all immigrants, not only legal immigrants, to all immigrants and other underserved population. Next slide, please. So we serve all refugee immigrants population, but our primary target group is refugees from Middle East and Sub-Saharan Africa. Next slide. So as I was saying, we address social determinants of health within refugee immigrant population here in Ohio. And one of the social determinants of health we focus on is healthcare access. We focus also on transportation. We focus on culture. We focus on language. We focus on education. And also we do have a care coordination services where we follow clients every day by performing home visiting and making sure our clients are getting all they need, because most of them, they have a barrier of language. Since we do have many community health workers who speaks many languages, including French, Swahili, Kirundi, Arabic, Spanish, Kinyamurenge, we make sure that all immigrants who are here who speak those languages are getting help they need by trying to address all these social determinants of health. Also, we provide cultural competency training to local healthcare system. We organize sessions with social work nurses, medical doctors, to give them information about the culture of the clients that they are seeing. Next slide, please. So for data collection and documentation, we use two software to document our assignment. One software is a care coordination system software, and another one is Antiberta software. And I think most of you are familiar with this software, the Find Help. Next slide, please. So now I'm going to share with you the processes we follow to validate the content of the messages that we produce for our clients. So can you move to the next slide? So I want you to pay attention here because this is really like the theme of today. So how do we produce brochures, slides, and make sure the content is medically accurate, and make sure the information is considering the culture of the clients who will use it. So these are the processes. First one, we have a partnership with University of Dayton Physician Assistants. This department, they design the scripts and the content of the slides for us. After the design, our internal medical team, we do have a nurse practitioner, a medical doctor, and a pharmacist. They review the slides, and after the review, they can add or they can modify a little bit. And then after their inputs, we submit the slides or the script to Montgomery County Public Health Department for their additions or their inputs. After getting the Montgomery County Public Health Department inputs, we translate the material, the slide or the brochure in different languages. The language we use here is French, Swahili, Kinyarwanda, Spanish, and very soon we will start also to translate in Arabic. After the translation, you see where we have the purple color. I want you to focus here. After the translation, we invite a multilingual team. This team is composed by medical doctors, pharmacists, nurse practitioner, physician assistant, and public health professional. They make a team and they review the content of the slides or the brochure. For example, if you have a brochure in Kinyarwanda, we will invite people who have medical background, who speak Kinyarwanda, who were born in a Kinyarwanda culture to review the material. After their feedback, actually we edit before we brand. We edit and we brand and we publish. So these are the process, the flow charts we follow for brochures and slides or posters. Next slide, please. For the video production, it's almost the same. What do? We receive a script from the University of Dayton Physician Assistant Department, and the script is reviewed by our internal medical team, nurse practitioner, medical doctor, and a pharmacist. After that, we submit the script to Montgomery County Public Health Department for their additions or inputs. After that, after the county input, we translate in a different language, as I said, in French, Swahili, Kinyarwanda, Spanish. And after that, we invite again the multilingual team, they do have like a medical background to review if the video, the script is medically accurate, and we review also to see if the culture of people who will watch the video is considered. And after that, we edit, we brand, we record, we edit, and we publish. Next slide, please. So this is our review team. Again, if you are thinking about to have the same team, they do not have to be in the same location. For example, our team, some of them, they are in Canada. Others are in New York. Others are in Georgia. Others are in Washington, D.C. And we are located in Dayton, Ohio. What do? We organize a Zoom call, and we submit to them the slides or the scripts or the brochures or the posters. And in a Zoom call, they are able to give us the feedback to see if medically the brochure is good, or to see if culturally the brochure is good. Let me give you one content validation example. Move to the next slide, please. Okay. For example, I guess you are familiar with PH29. PH29 is like a tool which helps to screen the level of depression. And this tool has 9 questions. All questions are good, but let me take an example of question number 7. When you go to the hospital, they can ask you one question like this. Over the last 2 weeks, how often have you been bothered by any of the following problems? Trouble concentrating on things such as reading the newspaper or watching TV. You can answer by not at all, or almost every day, more than half the days, you know. But if you take this question and you translate it into a Rwandan culture, the question will change, you know. Because in a Rwandan culture or a Burundian culture or a Congolese culture, they do not have the habits to read newspaper or watching TV. So you need to ask the question, but the question needs to be in a cultural context. For example, if I translate the question, the content in Kinyarwanda, we will say, over the last 2 weeks, how often have you been bothered by any of the following problems? Trouble concentrating on things such as taking care of your family, washing clothes, cooking, or chatting with friends. So I replaced the newspaper and watching TV by taking care of the family, washing clothes, cooking, or chatting with friends. Because in a Rwandan culture, they do not watch TV or they do not read newspaper. So I think this is the example I was giving you. And next slide, I think it's the question, it's the end. Thank you very much. If you have any questions, comments, please feel free to ask. Thank you.
Thank you so much, Jean and Lena. That was a wonderful presentation. I'll invite anyone who has any questions to add them either in the chat or in the Q&A portion that you see at the bottom, at the toolbar at the bottom of the Zoom. But we did get a few questions while you were talking that I think we can get to first while folks are thinking. So the first question is, Is there any kind of cultural validation certification or specialized training that people can go through if they want to do this kind of work?
Lina, do you want to go first?
I can kick things off.
Okay.
Absolutely, sure. So from my understanding, there's no kind of clear, widely accepted like certification that you have to go through, or there's no industry standards, at least at this time, for cultural validation. But that being said, as this sort of process and practice are to be something that we really wanted to emphasize within our organization, we started developing certain like trainings for individuals from our respective offices, or our interpreter departments to see if they were interested, in being part of really the cultural validation process. So really, in a sense, on our end, on kind of the programmatic side, developing trainings, sharing the trainings, getting feedback for actually from the community members. Is this the right process? Is this the right way to go about this? What is most accessible? And so we've been adjusting based also on community feedback, just based on what has working well for us. I don't know if Sean, you have
So,
anything more to add to that? Yeah.
yeah, in addition to what you were saying, Lina, we do not have really a certification requirement to validate culturally, because we believe that if you were born from a culture, if you have the training, if you have the medical training and you were born from the culture, you do not need to be really certified, because if you were born in the culture, that is considered like a certification, because you know the culture and you have the training required to review the material. We do not request the certification.
I think that makes a lot of sense, John, what you're saying. Like if you're from a culture, you kind of like will already know. But from an organizational perspective, I know we've worked with Lena and her colleagues at IRC to do this cultural validation process. And one of the things that we found that has worked well for us is given people specific questions so they know what their scope is. And so we might say, is the translation accurate? Is it culturally appropriate? But we also specifically ask, like, is the stock photo that we picked out gonna be acceptable or relevant to your community? We've gotten some really good feedback on that. And so just kind of letting people know, no, you're not just checking it for grammar, you're checking it for these other things, and other folks can really sort of take that and run with it as long as they're from the community. We have a couple hands raised. It's exciting. Jacqueline, I'm going to allow you to talk. Jacqueline, are you able to unmute? Okay, she might be having some issues. I will move on to the next one. Ernestine. Ernestine, are you able to unmute? Okay.
Do you think they can send the questions they are calling?
Yeah, you can feel free to send them in the chat if you're having trouble unmuting. Ineda, I will go to you. All right, feel free to add your questions in the chat. So I'll go on to the next one. So I know both of you, Jean and Lena, both of you talked about video. So I think you're gonna like this question. What is the best approach to reach people who have cultural or language barriers, but also aren't able to read and write?
The best approach, it's just using video, because you answered the question already. For example, I'm from Rwanda. In my culture, people, they do not have really the culture to read. People who went to school, yes, they read, but people who were born there and do not have the high education level, they do not read. However, when you send to them a video, that will be really the best approach instead of using the newspaper or anything else. Dina, do you have an addition?
Yeah, no, that's such a great point, John. And to add on, we've been very fortunate to work really closely with NRCRM to provide, I would say, like so many wonderful types of even like video and audio options. So video, it could be an animation. It could be more of like a testimonial of just seeing someone from within the community express maybe a mother, why they chose to get their son vaccinated. Or I know NRC Room had a wonderful video of a Congolese pastor as well. And that really resonated with our Congolese Swahili speaking community members to also see someone, a trusted individual, and to be able to share their insight. And that video in itself had subtitles that were reviewed to also ensure that kind of wider accessibility. I think it's not only just including the subtitles or maybe the captions themselves, which has been great, but also the type of language and terminology we're using. Is this going to be accessible to various educational or literacy backgrounds? I think that has been really wonderful to see. We're working alongside NRC RIM, but then also the different types of channels. Uh, just speaking really quickly, working closely with the Rohingya community who has actually preferred audio messaging. And that was really invaluable feedback to share potentially, as much as we'd like to have maybe written text or, documents that have what we believe is the preferred written text of the Rohingya community. A lot of individuals express, it would be great to have audio messaging through WhatsApp. That's the best way for us to receive that messaging, especially with those who can access that. Really dependent on where, when they might have fled, where they might have resettled, maybe generationally as well. So those are just really great things to keep in mind when you're not only in the review process, but in those like early development phases, like start asking individuals that might be cultural validators to think, is video the best approach? Is it not? What types of videos can we make? I think it's wonderful that, especially with the resources and expertise like NRC RIM, you can explore those different options.
Yes, very well said, both of you. Yeah, the video creation process has been a huge game changer for us. And working with IRC, we've been able to get, as Lena was saying, advice on before we even write the scripts. Like, how should we frame this? What kind of what kind of perspective should we center in this? And that's just having that from the very beginning has been really amazing. We have a few minutes left, but in case people have to hop off, I am going to launch a super quick poll, but don't worry, we'll keep going with more questions. So the next question is, how do you balance honoring somebody's culture who, maybe it's a culture who doesn't necessarily act on preventative medicine, for example, like how do you, or vaccines. So how do you balance honoring that with trying to inspire a change in someone's beliefs or their behaviors?
Dina, do you want to go first?
Sure. Yeah, that's a really great question. We definitely, it's also important to have conversations early on in the process with reviewers, especially for a lot of the different videos or materials we've created in the past. They're serving multiple communities. So when we think about accurate and appropriate representation, we want to be mindful of not only for a specific community in mind, but that this might be, for example, reaching multiple communities all at the same time, especially if it's a video that's showcasing different communities or an animation, not necessarily where it's like a specific graphic, that the example I showed in my presentation. I think it's important, again, to have those conversations early on, ask cultural validators, ask partners, if you have an advisory board, ask your advisory board, what is the best approach to even address this subject, not even the text itself, not even, of course, the message delivery, but what is the best approach? I know I gave the example for the Ukrainian community, and then NRCRM did an amazing job of not only for that community, but respective communities of what is the best way to showcase sensitive and private information? Is it solely through the channels? Is it the actual message itself? Does this need to be shared by a certain member of the community? Does it need to be showcased along important religious ideology? I know really quickly, I'll say with Ramadan, it was really important to, although discussing the importance of staying healthy and safe, understanding for community members, well, how does this impact my fasting? And that's what I'm most worried about. Will this break my fast? So you have to also have those kind of key, insights that you might not necessarily be aware of to understand how to best approach those maybe very culturally specific and sensitive topics. I don't know, John, if you, yeah, please add more to that, of course.
So I think the other way to balance or to respect the belief and the culture of someone is to pre-test. When you have like a message, it's always better to pre-test, to bring a group of 10 or 20 people and you present the message to them, and from the feedback they give you, you are able to frame a message which is really capturing the belief and the opinion from everyone.
Thank you both so much. I think we have time for about one more question. For something like a fact sheet, for example, how long does a cultural validation and translation review process take? And so for urgent communications, are there strategies for expediting that process? I have some thoughts, but I'm interested, Jean and Lena, in hearing from you too.
John, please definitely feel free to kick things off.
Okay, you are asking about to speed up the process so that like
well, how long does it take, and how are, if something's really urgent, are you able to speed it up at all?
Yes, yeah, it can take like 30 days, like a month. But if it is something which is really urgent, like one paper, it can take like 4 days. So you translate, you send the message to the review team, they give you the feedback by email, and it can take like 4 days. Yeah.
Yeah. I would say, just to quickly add on, because I know we're closing in on time. I think John said that very well. It also, yeah, it matters on the context. Sometimes we've had very quick, rapid messaging that we need to get out almost within, a 2-day turnaround. So that wouldn't be something like an extensive, document per se, maybe a quick couple paragraph audio messaging or a quick one pager. And so working closely with our validators, with those that we work generally and typically with, to see what's feasible for a quick and rapid translation review. That does happen, but oftentimes, although I don't know if it's hard to believe or not, it does take some time. We want to be very thoughtful and intentional about the feedback that goes in, especially if there's multiple different versions, as I mentioned, and keeping track of those versions. And we ultimately want to do that all before, as John also mentioned earlier in his presentation, before any like major branding or editing takes place. So that those typically take just a few days, but those iterations of the review could take, up to a week, maybe longer. It really depends on the nature also of the document or the media, but in the toolkit, and I know John has wonderful resources in the link that was shared in the chat on NRCRM to also describe different ways to kind of go about that. So.
Thank you, and we are 1 minute over time. Thank you so much for those of you who are able to stay from the end, and look for an email from me later this afternoon with recording, the slides, and links that we shared in the chat today. Thank you so much.
Welcome.
Thank you so much, everyone.
Thank you.